I'm Dr. Freddie Gomez, and thank you for joining us here on The Doctor is In. The COVID 19 pandemic has brought about an unusual challenge for all of us. While staying at home keeps us safe from the virus, it doesn't protect us from developing an unhealthy lifestyle. Constant snacking and binge watching with little to no exercise can lead to lifestyle related illnesses. That's why it's important to take extra steps to prevent them from happening. With us today is Dr. Maria Princess Landicho-Kanapi, an endocrinologist practicing at the Makati Medical Center. Thank you for joining us, Dr. Sess.
Hi, Fred. Thank you for inviting me. It is my pleasure to join you on your show.
Now, Doctor, the quarantine has made a lot of people sedentary o kaya yung kulang sa physical activities. And these people are more likely to have an unhealthy diet. This change in lifestyle can leave a lot of us more vulnerable to other diseases aside from COVID 19. So, first of all, Doctor says, can this quarantine negatively impact our health when it comes to yung overall metabolism ng katawan?
Yes, you are right, Fred. This quarantine could have a big impact on our health. Why? Because most of the people are just at home, and the quarantine is also giving us some sort of parang panic or anxiety. The quarantine could give us stress because we are afraid to contact the virus, the COVID-19 virus. The quarantine could also lead us to be just at home with less in physical activity. Most people could turn to increased screening time, like watching social media or just watching TV, and lesser physical activity, and this could give a toll on a person's health. So this pandemic is quite a risk also for our for the other people to have lifestyle related or lifestyle diseases.
That's right, ano? Now, there are a lot of possible diseases that can come about due to a sedentary lifestyle. But Dr. Says, could you just give us the most common ones that us Filipinos should be concerned about?
Yes, Fred. Because unfortunately, us Filipinos, we are not immune to this lifestyle-related diseases. The most common one will be common also globally, and it will be your cardiovascular disease o yung mga sakit sa mga blood vessels like your heart disease or sakit sa puso or a blood vessel-related disease which also affects the blood supply in our brain. It's called stroke or TIA, or what you call transient ischemic attack. This could also lead to fatal or lethal. It could be lethal, like a stroke or a TIA. And the other lifestyle related diseases could be your diabetes. It could also be cancer. It could also be chronic respiratory illnesses that could be related to, for example, smoking. That's a lifestyle. If you frequently smoke, it could lead to illnesses such as COPD. If you do not eat healthy, it could like you have increased blood sugar. You could have increased blood sugar level if you are a fan of eating a high sugar food. If you're a fan of eating high salt content food, then you could have hypertension, or it could lead, or it could be a risk for heart diseases such as a like angina or a heart attack or even heart failure.
Ayun, so marami talaga, doctor, no? So clear naman that lifestyle diseases are not contagious, pero ito ay maaring ma-develop over time. Now, aside from a sedentary routine, doctor says, itong mga lifestyle-related diseases, especially those that, like what you mentioned kanina, yung smoking, as well as alcohol drinking, can this quarantine exacerbate or mas gagrabe ba ang kondisyon ng mga naninigarilyo na at mahilig uminom?
Ayan. You know, what's good thing about nung quarantine tayo is that pinagbawal ang alcohol, okay? And people don't go out. So people don't get to socialize as much. Hindi masyadong nakikipag-socialize. Hindi masyadong ma-attend ang mga birthday parties, mga handaan, na wala ang taunang fiesta. So this has led, I think, to lessening of the intake of alcohol or of course smoking. You don't want to smoke inside your house, no? In a way that has helped, but most Filipinos now, they are fond of, ano ginagawa natin pa nila sa bahay? Cooking and eating. So yung mga unhealthy food, dyan naman napapalitan, nagiging unhealthy ang diet ng mga Filipinos because marami na ngayon nakikita natin sa social media, marami nagbe-bake. So that will be cake, that will be donuts, that will be your mga high sugary food na pagkain. So kinakailangan i-balance natin ito. We don't eat too much of those kinds of food.
Totoo talaga na mahilig talaga mga Filipinos na kumain. So this quarantine will just give us even more reason to be able to eat more. But like what you said, moderation ang napaka-importante doon. Now, Doctor, let's further continue this discussion by answering some questions that we have from our viewers. Meron tayong question galing kay Odessa. Ang tanong ni Odessa, what particular age group is at risk of lifestyle diseases? Paano po makakaiwas dito?
Okay. Hi, Adeza. Thank you for your question. Actually, all age group, kahit nga bata, if yung bata or yung the younger ones are fond of eating, kasi minsan nagpapa-deliver tayo, no, mga fast food, then pwede magkaroon ng bata ng sakit katulad ng childhood obesity. Some children also have high blood glucose level and some have high blood pressure kahit na nasa teenage life pa rin nila. But most of the time, we watch or we see these lifestyle diseases among adults. Mga patients aging or persons aging from 20 to like 70, 79 years old. These lifestyle diseases are common among these patients.
Okay, thank you for that question. Oddly, Odessa, I'm sorry. Now we have another question. Ito naman ay galing kay Beverly. Can my sleep routine negatively affect my health and the likelihood of these lifestyle diseases? What do you think, Dr. Says?
Okay, sleep. Siguro si Beverly speaking about sleep, siguro not being able to sleep on time or not having enough sleep. Among us adults, we need to sleep for like 6, 7 to 8 hours a day. Okay, yun yung hours ng sleep na kinakailangan natin. Because stress, kung ang lifestyle ng isang tao ay stressful in terms of you have too much work or you're stressed with working from home kasi kahit kailan pwede kang tawagan ng boss mo, no? So kung nasa-stress ka, that could also affect. If you cannot sleep kasi kahit madaling araw tinatawagan ka because of work, then that could also lead to lifestyle-related diseases. The other one is stress of employment. The other one would be stress of unemployment. Halimbawa, you cannot sleep because you don't know what to do the following day because you were laid off from work, hindi na makakapagtrabaho because of this COVID pandemic. That is also a reason why a person could have high blood pressure, high blood glucose level, because stress could add to the burden or to the levels of these particular diseases.
That's right. So stress talaga. Maraming hindi magandang naidudulot ang hindi pag-manage ng stress. We'll be taking a quick break, but in just a moment, we'll talk about weight management this quarantine. This is the Doctor's In on CNN Philippines. We're glad to have you with us on the Doctor's In. I'm Dr. Freddie Gomez. Many of us try to incorporate different diets into our daily routines. Unfortunately, diets don't always work, lalo na while in quarantine when you're feeling anxious or stressed. What is often more effective is a permanent change in eating habits. Kasama pa rin natin ngayon si Dr. Maria Princess Landicho-Kanapi na isang endocrinologist o isang eksperto sa lahat ng mga proseso, both biological and chemical na nangyayari sa isang tao. Ngayon, Dr. Says, we know that weight management is lifestyle-related diseases. What are weight management strategies that you could share with our viewers that we can adapt into our everyday lifestyle?
So weight management, one of the hardest things to teach our patients. Ang hirap kasi magsabi sa pasyente na you have to get off of your chair and you have to move and you have to exercise. They would often tell us, Doctor, I have so many things to do. Ang dami kong ginagawa. Kulang ang 24 oras for me to exercise. And then I would often tell them that you have to move. You have to exercise. It will take like 30 minutes per day, 5 times a week, or 150 minutes per week for you to get a good exercise. The exercise should be an aerobic or resistance exercise. So kinakailangan gumalaw ang mga muscles ng katawan and you have to do it. Kinakailangan natin ng hindi light intensity ha. We need moderate to high intensity exercise. So what are the samples of our moderate intensity exercise? It could be brisk walking. If you love to dance, why not? Go dancing. If you like to swim, kung meron namang area sa inyo, if your house has a swimming pool, pwede mag-swim. Or even the simple household chores. Hindi na kasi uso ang pagbubunot ngayon, Freddy, isang napakagandang form ng exercise yan. And the other thing, ang maganda, ang gustong gawin ngayon ng mga Filipinos will be taking care of the plants. May garden o wala, uso ang paghalaman. So one form of exercise could also be gardening. For high intensity exercises, you can allot a portion of your house, maliit na portion lang, that you could do like you could do continuous skipping rope. You could get some weights, maraming nabibili online na weights, and you could use some weights. You could jog in place. You could do rapid or vigorous jogging in place. Yung mga ginagawa nila, yung uso ngayon sa gym, circuit. You can simulate those exercises at home. But be sure you have to for the first 5 minutes, kinakailangan light exercise, followed by rigorous exercise, and then you have to tone down a little before you stop your exercise. Kinakailangan mag
Okay, medyo na-cut ang feed natin with Dr. Ses. So, while we're... Okay, we're back
I
with Dr. Says. So those are very good examples on how to keep someone's body moving, ano, Dr. Says. So all those types of exercise, low, medium, and high intensity. Ngayon, Dr. Says, palagi nating naririnig ito, no? A lot of our viewers hear it na always eat healthy, always eat a balanced diet. But sa point of view ng isang endocrine expert, ano ba yung itsura ng isang healthy at balanced diet? Ano yung marerecommend mo sa ating mga viewers?
Okay, the easiest way to know if you are eating right is the pinggang Pinoy. FNRI advocates pinggang Pinoy. Yung pinakamadali, portions. We should know our portions. This is the Filipino version of the Idaho plate. What you should do in a 9-inch plate, yung usual na laki ng pinggan na ginagamit natin sa pagkain, you divide that into three. Half of the plate will be your green leafy vegetables. Lahat ng berde, kangkong, talabos, alugbati, your lettuce, broccoli, yan. Pwede mong gamitin yan. A small fruit would also be added para sa mga may pasyenteng may diabetes, 1 serving. For those with no diabetes, mga 1 to 2 serving would do, even up to 3 servings. Then the other half of your plate, you divide it into your carbohydrates that could either be your rice, or if you like bread, or if you like pasta. Pero isa lang dun sa tatlo, ha? Huwag sabay-sabay. So that will be 1/4 of your plate. The other 1/4 will be your protein. So ano ba ang healthy protein? Siyempre yung hindi matataba. Ayan, nakikita nyo sa screen. Nako, lechon kawali ba yan? So wag pong palaging ganyan. Kinakailangan natin sa protein will be your white meat. And your white meat will come from your fish or kahit dun sa pecho ng manok. And also make sure kaunti lamang ang asin na nilalagay natin sa ating mga ulam. So a small portion of salt will be added just to give it a little taste. The other condiments that you can use to make your food palatable will be your vinegar, will be your pepper. So may marami tayong ibang pwedeng gawing alternatives to condiments to make our food palatable. Iwasan po natin ang mga pinirito. Mas maganda po ang mga nilaga o kaya inihaw o yung mga bulang lang na gulay will be very good. Iwasan yung mga sinangkot sa mantika because your saturated fat, like your mantika or saturated fat from butter, from margarine, will not be good for your heart. We don't like.
That's very good, ano? So, a healthy and balanced diet naman pala does not have to deprive someone dun sa mga hilig niya, kung ano yung paborito niyang kainin. Because this can lead, of course, to being overweight. Now, being overweight or obese increases the risk naman of developing type 2 diabetes, which unfortunately is very common amongst us Filipinos. Dr. Says, could you briefly explain to us what is type 2 diabetes? At kung may type 2, meron naman type 1, hindi ba? Pero bakit napaka-common yung type 2?
Yes, tama ka ulit, Fred, no? The most common type of diabetes will be your type 2 diabetes. More than 90% of patients with diabetes will have type 2. So ito yung nagkakaroon ng diabetes ang isang tao most of the time in adulthood wherein kulang ang insulin sa katawan. Or there is also insulin resistance wherein your body does not use the insulin properly. And yung sinabi mo kanina, Fred, obesity, isa yan sa mga dahilan kung bakit hindi nagagamit ng katawan natin ng mainam ang insulin. So obesity could be a risk factor for patients who could be diabetic later in life. So do you want to know, Fred, kung anong waistline ang to watch out for para maging sabihin natin na at risk ang isang pasyente sa diabetes? So get your medidas, measure your waist, people. So ang waistline sa kalalakihan na more than 35.4 at sa kababaihan na more than 31 inches, that could be a risk for diabetes. The other risk factors could be age.
Napaka-specific way.
Yes. Other risk factors will include your age. If you are more than 40 years old, under the Unite for Diabetes, the Philippine guidelines will tell us na ang mga taong 40 anyos pataas, so 40 years old and above, should already be assessed if they are at risk for diabetes and should already have blood tests like your fasting blood sugar or 75-gram OGTT to test if you are diabetic or not. The test could be done earlier kung mayroong mga risk factors katulad nga na sinabi natin kanina, obesity, hypertension, malaking waistline, previous history of pre-diabetes. So those are the other risk factors among others of having diabetes mellitus type 2.
Ayun. So thank you very much, Dr. Ces Landicho-Kanapi, for joining us today and giving us very helpful tips on staying healthy and safe. Coming up on the program, let's talk about managing diabetes naman during a pandemic. Stay with us right here on The Doctor Is In. dealing with diabetes are at increased risk for COVID 19. And this makes managing this disease during this pandemic extremely vital. So it's important to know the best practices in managing diabetes and thereby reducing the risk of infection. We're joined by Dr. Jeremy Jones Robles. He's the president of the Philippine Society of Endocrinology, Diabetes, and Metabolism. Welcome to the show, Dr. Robles.
Hi, Fred. Thank you for having me. Thank you for the invitation.
Now, doctor, can you briefly explain to us how does this pandemic complicate the management of diabetes?
Okay, so pretty much we all know that the diabetes is a chronic disease, no? So dapat we should keep that in mind, no? Na kahit may pandemic, wala ng pandemic, yung mga taong may diabetes, tuloy-tuloy pa rin yung ano nila, yung dilemma nila with the diabetes. So what this pandemic did, actually, it put us in a halt, no? Lahat tayo affected. So mahirap dito because even the management of diabetes is also affected. So, ibig sabihin, they cannot visit their doctor, no? And then some of these patients, no, they have to understand na yung mga gamot nila dapat tuloy-tuloy din, no? So, we all are adapting to the changes. We're trying to make a way for us to bridge this particular part kasi alam naman natin and we hope that itong pandemic na to ay mawawala na rin eventually, no? So right now communication is very important and the management of diabetes very important that the patient and the doctor also be able to communicate. I think you touched earlier or some of the important things, the pillars of the treatment of diabetes. Dr. Says actually talk about it. We have this four pillars. We have the apat dapat, no, which stands for one, your doctor. Kailangan po, you need to communicate with your doctor in terms of your blood sugar control, at saka yung mga medications mo, no? Second, you also have to have good diet, and you discussed this earlier. Okay, and exercise is also very important. And lastly, the medications. So medications dapat tuloy-tuloy lang. We always emphasize with our patients that if you're on oral medications for diabetes, dapat tuloy-tuloy lang. Even yung naka-insulin, tuloy-tuloy lang din, no? So again, there are some changes. We're all adapting. Doctors are learning telemedicine. The patients are also trying to adapt. Yung mga patients natin, the younger ones, very easily they can adapt and they can adjust. Pero yung medyo a little bit on the higher age, napapatulong na lang sila sa mga anak nila, mga apo nila, no? So pretty much yun. And then, of course, there are limitations because some of our patients, they're scared to go to the hospital or the clinic kasi natatakot sila. And we can understand the apprehensions because kahit yung mga doktor din, natatakot din, no? But overall, I think it's slowly trying to improve. The whole situation is slowly improving. But, we've learned our lessons from this pandemic. So dapat mag-ingat tayong lahat. So we always tell our patients the key lessons for this is we need to be careful with regard to how we deal with protecting ourselves, especially the diabetic patients kasi sila yung nasa risk lagi, no? So dapat mag-ingat sila, no? So social distancing, washing your hands, no, staying away from people who look sick, no? Yun ingat kayo kasi kayo yung pinakamalaking risk in terms of ang tawag nito yung mahawa kayo sa COVID, no? So those are some important things that you need to consider with regard to COVID and diabetic patients.
Yes, you gave very good points there, Dr. Robles, especially the part where all of us, lahat tayo, doktor at pasyente, are trying to adapt with this current situation brought about by the pandemic, But we'd like to learn a little bit more about the management and how can those adapt with managing the diabetes at mahalaga rin sigurong malaman kung anong importanteng role ng mga caretakers especially in monitoring the blood sugar levels of those people dealing with diabetes.
Yes. Okay. So we're going to talk about a little bit on technology, no? So we used to monitor our patients in terms of checking their blood sugar. So nagpi-finger prick sila, no, several times a day, no? So at least now we're happy that Abbott has actually brought in the CGMs, no, continuous glucose monitoring. Ito yung mga nagmo-monitor ng sugar na may kakabit sa sensor sa braso and then isa-scan mo na lang, no? So you don't have to prick anymore. So that's very important. It's really a game changer, not only for patients that are admitted, but also on the outpatient setting, pag uwi nila, if they caught COVID and they're doing okay, and then pag uwi nila, you can continue monitoring kasi ito, good for 2 weeks naman ito eh. So that eliminates the part na yung napiprick yung patient, yun ang iniiwasan nila kasi ayaw nila yun, no? So you talked about diet as well, no? You have diabetic specific formulas. That's very important also. These are the newer technologies that complement the current management, no? So nangyayari, nutrition is very important, monitoring of the patients very important. Kailangan po ito hand in hand with the treatment, no? So ito po yung mga newer technologies na ginagamit natin laban sa COVID, no? So very easy for the patient. We teach the patient how to scan and get their blood sugar, and then it can do a graph already, and they send us the graph, and they can do this online and send it to us, and they can communicate to us. As I mentioned earlier, marami ng apps, no, for the patient and doctor to be able to communicate, and this is really something that's very dynamic, and we're all learning from it, but we're just glad that these new technologies are here to help us manage our patients, no?
Okay, if there's one thing this pandemic has showed, na we're able to maximize talaga yung mga technologies na available to us today. So thank you very much, Dr.
Yeah.
Robles, for helping us answer all these inquiries that we have with regards to how to manage diabetes in this time of the pandemic. And to our viewers, thank you also for joining us for another session. Remember, let's all do our part in taking care of ourselves so that we can take care of others. I'm Dr. Freddie Gomez, and I'll see you again next time on The Doctor Is In. Stay safe, everyone.